A recent article in Kenya's Business Daily said cesarean sections are becoming the new trend in childbirth for young women. But talk around Kampala is that the poor diet of today's young woman may also be a contributing factor. So I set out to find the truth or otherwise of these claims. Naturally, I start with consulting a doctor. My first question was if diet had anything to do with the increased need for C-sections.
No, absolutely not. The only thing that can change with generations is the size of the babies and the size of the bones.
And Sister Molly Businje agrees with him.
It's not really related to that because mothers, whether you eat good, whether you eat bad, at the end of the day you have to push.
Even with the rise in C-sections, Uganda is undertaking between 1 to 3% emergency operations, which is way below the required World Health Organization standard of between 5 to 15% C-sections in a year. So what explains the claims of increased operations?
If you look 20 years ago and say how many women have access to health care and therefore be able to monitor what's happened to the baby in the first week of life, there are probably more women today who have access to health care and you can monitor the babies.
These days, in the crisis of HIV, mothers think, and we, the nurses, think that when one delivers by cesarean section, she has less risks of infecting the baby.
Over the past few decades, cesarean sections have been increasing almost everywhere, partly because patients can now get cesarean sections on request. But doctors in Uganda say that cesarean sections given here are not just another fashion statement. Many young mothers visit the antenatal clinic at Kiswa Health Center here in Kampala. Maria Musubika is one of them. She is expecting her second baby after giving birth to her firstborn by C-section.
When my labor started, it went on for a long time, so that doctor told me that I have weak bones and I won't be able to push, so he ordered for a C-section.
She plans to have another C-section, but unlike Mariam, Franklin Komukama wants a baby the old-fashioned way.
I want to give birth naturally because the first time I had a C-section. This time I want to be able to push.
In the UK, the term too posh to push is sometimes used to describe women who request elective cesarean section without doctor's advice.
Because of modern living, some of our girls now have started copying some styles outside, maybe abroad or whatever, like the Bazungus. I hear they opt for cesarean section because they don't want that pain.
By 2006, the last year with available data, the rate of US births by cesarean section had reached 31.1%, the highest ever. C-sections may contribute to the growing number of babies who were born late preterm between 34 and 36 weeks gestation, which exposes them to certain risks.
They are likely to develop problems with breathing and also risks of the medicines that have been given to the mother for delivery, whether it's injection at the back, spinal anesthesia, or medicine for her to sleep, general anesthesia. Those can also affect the baby.
Dr. Okong emphasizes the importance of natural births.
If labor starts naturally and the baby is subjected to this process of delivery, it also helps their chest and lungs. And by the time they are delivered, they are ready to go. They are ready to breathe and start.
A study by researchers published last year in the Journal of Child Psychology and Psychiatry suggests that the bonds that tie a mother to a newborn may be stronger in women who deliver in the natural way as opposed to the C-section. The risks of cesarean births are many, and doctors advocate that the natural way should be the way to go. But it's every woman's prerogative how she will have her children. Rosemary Nankabira, NTV.